Well, hi, this is Dr. Sedano, the Director of Clinical Support and Education at Avexi Diagnostics. I just want to share with you some insights into the currently available diagnostic panels that have a huge clinical value for any functional medicine practice. Now, these panels are what I believe to be the most critical and relevant panels to create a strong diagnostic foundation for your patient's wellness plan. It's important to remember some of the rationale for ordering laboratory blood studies, and these are going to include things like establishing a diagnosis, ruling out serious conditions, guiding the course of treatment, assessing the effectiveness of treatment, screening for disease, and of course, assessing for nutritional status. So the panels that you should consider, and the ones that I want to talk a little bit about, are the Avexi Wellness panels. Now, these panels, they can provide a foundation and a starting point for assessment of overall health of your patient. Now, these panels, they can assess for conditions such as anemia, iron deficiency anemia, vitamin B12 deficiency, thyroid disease, liver gallbladder dysfunction, kidney dysfunction, blood glucose dysregulation, infection, and dyslipidemia, not to mention a whole bunch more. So you can see how important these panels are. So as you can imagine, the lab tests on the wellness panels are considered an essential part of the initial clinical workup and a prelude to further testing such as your functional medicine test. So let me give you an example. So individuals that present with gastrointestinal dysfunction, such as constipation and SIBO, and we know there's a lot of folks that have SIBO out there, if they're suffering from hypothyroidism, that's going to slow down GI motility, impacting both of these conditions, meaning constipation and SIBO. So you can see how important this is. So currently there are 5 versions of the wellness panels available. Now on the Avexi website, you're going to find a wellness panel comparison chart. Now that's going to help you select the most appropriate panel for your patient's diagnostic needs. So I hope you find great clinical value in these panel recommendations and that they serve you and your patients well. Until next time, I wish you all the best personally and in practice.